Cognitive behavioral therapy is one of the common types of talk therapy in psychotherapy. You work with your mental health counselor, psychotherapist or therapist, in a structured way, attending a set number of sessions. CBT helps you become aware of negative thoughts so that you can see more clearly and deal more effectively with difficult situations. CBT can be an excellent helpful tool in the treatment of mental health disorders such as depression, phobias, schizophrenia, eating disorders, and post-traumatic stress disorder, either alone or in combination with other treatments. It is important to note that CBT is not just for people with abnormal mental health conditions. Everyone can benefit from it. Because CBT helps people learn how to deal with stress better in many cases, which is why it is such a useful tool for helping people learn how to cope with stress. Do you know why this is done? Cognitive behavioral therapy is indeed used in solving and treating a wide range of problems. This therapy is preferred because it can help identify and eliminate many problems faster than other types of therapy. On the other hand, compared to other types of therapy, this therapy requires fewer sessions and is carried out in a structured way. CBT is a very useful tool for dealing with the emotional problems that many of us face today. These may include prevention of recurrence of symptoms of mental illness, treatment of mental disorders unresponsive to medication, teaching ways to cope with the stressful situations you have to face, identifying ways to properly manage emotions, resolving conflicts within the family and many other relationships, and teaching better ways to communicate. Ways to not lose yourself in a moment of grief or loss. Dealing with the emotional trauma of violence and aggression. Fighting medical diseases. Mental health disorders that can be treated with CBT include depression, anxiety disorders, phobias, post-traumatic stress disorder, sleep disorder, eating disorder, obsessive-compulsive disorder, addictions to drugs and alcohol, schizophrenia, sexual disorders. Often, CBT works better and more quickly when combined with other treatments, such as antidepressants or other medications. It is important to note that this therapy may have some risks, as with many other therapies. Although these risks are very small, you should be aware that sometimes you may feel very emotionally disturbed during a therapy session. This is because CBT focuses on exploring the feelings, emotions, and experiences that cause you pain. During a painful session, you may cry aloud, get upset, or make angry. You may also feel physically exhausted. Some forms of CBT can make you face situations you fear. For example, if you have a fear of flying, getting on an airplane, or approaching tall buildings, if you are afraid of them. Situations like these may cause temporary stress or anxiety, but you should prepare yourself for the positive outcome. As always, working with experienced therapists in administering these therapies will minimize the risks. Remember that the coping skills you acquire will help you manage and overcome your negative feelings and fears.